Hi everybody. Hope everybody's keeping well, keeping safe, and looking after themselves. I thought I'll do this video on alcohol addiction, but what I'll do is I'll use material from a presentation that I did at university last year. I thought I might as well make use of that. I might as well share kind of what's on that presentation. So if you keep seeing me looking to my right or your left, I'm looking at the slides. I haven't got pro enough yet to stick a projector behind me at the minute, but I'll go off the slides. I've got another computer to my right, your left, maybe on over there. So if you keep seeing me glancing that way, I'm reading off the PowerPoints. So basically, what I'll do is I just thought I'd do it more for awareness, if anything else, really. Because I guess, some of the things that's obviously this presentation I did at unis was for a mental health module. And I did mine on alcohol addiction. I'm in recovery myself, so I thought it was probably something I thought I'd probably know, quite a bit about. But obviously the things university want you to talk about, it isn't me, is it? So, but anyway, I did it on alcohol addiction, like I say, and I think more than likely chose this subject because I'm in alcohol recovery myself, almost 11 years now, so not doing too bad. Take each day at a time. So anyway, I'll look at the first slide. Well, I won't look, go in the aims and this, that, and the other, because I'm not actually doing a presentation. But so the first slide really is prevalence and demographics. So that's the how widespread alcoholism is and who it affects really in society, I guess. So I've got on there over 1.4 million people in the UK are dependent on alcohol. Now that's coming from Alcoholics Anonymous, the AA, 2016. So I'm not sure how far back, they take their research, but they're saying, over 1.4 million people are dependent on alcohol. So dependency could mean a number of things. It's how true those numbers are is I don't know. I'm not saying they're not true. However, the 1.4 million dependents. Now, what's dependency? I kind of argue this. Alcoholics Anonymous. Alcohol services these days don't like to use the word alcoholic. I do. I say I'm an alcoholic because I am. That's what I am. Now, Alcoholics Anonymous say there's sorry, this lighting off the computer here has gone off. They're saying 1.4 million people are dependent on alcohol. Now, dependency for me can mean a number of things. It could mean your dependence on alcohol to go into a social situation, but you're not necessarily drinking every single day. You could be dependent on alcohol to have a good time, to feel confident. You could be dependent on alcohol every single day also to get through the day. But I don't know. Dependency can be quite a broad spectrum, really. So anyway, the AA, Alcoholics Anonymous, suggest or state that there's 1.4 million people in the UK dependent. Now, of those 1.4 million, 65% male, 35% female. That's NHS Digital 2016. So that's quite interesting, really. 65% are male. Having said that, it would have been interesting if I'd have put comparisons from 30 years ago. because I wonder if the percentages may well have been would have read differently. Would it have been 75%, 25%, male, female? I don't know. I should maybe, when I did this presentation, could well have put a comparison in, really. But it says 65% male, 35% female. Don't know the age group. Well, no, the next one actually is age groups affected is deaths. Well, deaths affected by deaths. So as far as the 65% and 35%, I'm not sure of the age groups there on dependency. But the death rate, anyway, the highest death rate comes between 55 and 64-year-olds, and the lowest affected by death is 25 to 29, and that's the Office for National Statistics 2014. Now, the highest deaths rates 55 to 64. It would be it's again those numbers there. I wonder what they would have read 20, 30 years ago. But yeah, quite interesting that it's still it's the older generation. It's still, which you would kind of expect, really, that's affected by deaths due to alcohol consumption. However, it does suggest, obviously, that there's a lower percentage, 25 to 29. So therefore, even that, there is still people at a very young age, obviously consuming X amount of alcohol, and are dying from it, which is tragic. Age of starting drinking, which is interesting, 4%. 11 to 15-year-olds drank at least once a week. That's NHS Digital. By the way, this presentation I've not looked at. I've only just turned it on and doing it, so I can't, I'm to familiarise with it. But no, age of starting drinking, 4%. 4% of 11 to 15-year-olds said they at least drank once a week. Now, I can kind of relate to that one, because when I first started drinking, I was 10, so I snuck in under the radar there with that one. But 4% of 11 to 15-year-olds, I don't know how many 11 to 15-year-olds there are, and maybe what kind of backgrounds too, as in like race, religions, ethnicity, whatever, is it what, it just says 4%, so I assume it's across the board. But I'd imagine it's still a fair amount, 4% of, if the number 11 to 15-year-olds, I don't know how many there was, I never looked, so I just took these statistics. That's from an NHS Digital also. And that was 2016. What do people drink? Well, 35% is, beer comes in at 35.6%, wine 32.9%, spirits 21.6%, cider 8.5%, and alcopops 1.4%. And that's Drinkware 2016 statistics. Still interesting, beer is still the highest, but then again, wine now is coming in a close second, which I kind of expected. I think people, male and female, are going for drinking wine these days. But yeah, cider's up there as well, 21 point, which is, I was quite surprised when I did the presentation that cider would be up there. So the next slide was diagnostic features, characteristics and symptoms. And I've got diagnostic elements for alcohol use disorder, that's AUD, is assessed by a patient meeting 11 different criteria. This is in the DSM-5. It's split into areas, mild, moderate and severe. So I don't know if anybody's familiar with the DSM-5, but it's like this, psychiatrists use that, and the ICD-10 in this country to determine a patient's or an individual's diagnostic criteria, really. So, same say for borderline personality disorder, which I have, I would have to, a patient would have to at least have some of these various characteristics, and then it's decided whether it's mild, moderate, or severe. It's the same with the alcohol use disorder. That's the term used in the DSM-5. Like I say, that's a diagnostic tool for you mainly. I think psychiatrists use it, possibly psychologists and whatever, but I know it would be psychiatrists really in this country anyway, the UK, because they're the people who diagnose morbid disorders. So blood test to determine this blood test. Well, that's the DSM-5. That's how it's that's what that explains, is that you need to meet you're assessed by 11 criteria, and you're assessed mild, moderate to severe, depending on how many of those criteria you fall into. Blood tests to monitor liver function, primarily the gamma GT. Clinical history. There's clinical history, abdominal ultrasounds. That's Martin 2008. So basically, it was when I went for my blood test. When I went to my GP, it was a case of blood test, gamma GT. I think there's the ACL or something like that, or 80. I can't remember now. Quite remember. But that generally with alcohol, it affects the gamma GT. So with a blood test that shows up. Clinical history. And an abdominal, probably that will be to check your liver. Some of the characteristics of alcoholism, it would be low self-esteem, dependence, anxiety, and coping. That's suggested by Mannery et al. 2015. There is a reference list at the end of these, but I won't go through them all. Symptoms: nausea, vomiting, blood, liver disease, blackouts. I did plenty of blackouts, and I also personally myself did the throwing up blood, nausea. I did get it sometimes, not often, but they are typical symptoms. Vomiting, vomiting blood. I mean, when people hemorrhage through alcoholism, I've witnessed this, not myself obviously, but I've witnessed this with a family member, and it's gruesome. Hemorrhaging's not on there, vomiting blood, but hemorrhaging is vomiting blood, and it goes everywhere. Trust me, it does. But obviously liver disease, cirrhosis, blackouts. I had lots of blackouts. I've blacked out football matches in the past, in the 80s. I've even blacked out an FA Cup final in the 80s. I went to a few FA Cup finals in the 80s. The one I did block out was the right one to block out. We lost 1-0. But anyway, withdrawal symptoms: shakes, sweating, nausea, seizures. Well, with the seizures, alcohol. If somebody's alcohol dependent, or as I say, an alcoholic who needs alcohol every day to function, if you've been drinking this at any length of time, you're likely, if you stop drinking all of a sudden, it's not guaranteed, but you can have a fit and a seizure, and it can actually be fatal. So stopping completely, just there and then, abruptly then, without weaning or without going into a detox or rehab, detox really first, then rehab, you can run the risk of seizures and blackouts, and it can actually be fatal. I don't know what the percentage is, what the risk rate is for that, but it can happen. I think alcohol's one of the few drugs that can actually kill you by just stopping. Anyway, so moving on. Feels like I'm at uni. This safe drinking levels. Here we go. So it's based on keeping health risks to a minimum. it is safest that both males and females do not drink regularly more than 14 units a week. So now we've got this for 14 units per week for male and female. Now, not too long ago, I don't know how many years ago, it used to be 21 units for a man and 14 for a woman. Now they're saying it's 14 units apiece. And a few years back, it actually used to be 28 units, I think, for a male, and possibly 21 for a woman. I don't know, but I know this is fairly recent. The 14 units for males and females, and that's Drinkware who suggests this. I suppose the safest amount of units is no units, isn't it? Because at the end of the day, alcohol is a poison. But they're saying no more than 14 units a week, and I don't think it's a case of having 14 units in one swipe, like in one go. I think that's spread over the week. Like, I think that's what they're suggesting. What does a unit of alcohol look like? Well, 4% standard cider is at 218 ml. You've got a standard 13% wine at 76 ml, 25 ml standard 40% whiskey or the spirits, 250 ml of 4% beer, and 250 ml of 4% alcopop. They all amount to 1 unit. So as you can see, you could soon top those units up. And people who are addicted, dependent, and whatever term you want to use. I personally was drinking anything between 20 units to 50 odd units a day, so depending, working and not working. So I smashed that easy, but it is easy done. So it just goes to show we need to be really aware, of what a unit is. Let's have a look. Right, predisposition and causation. I've got here on this slide, if there's a family history of alcoholism, a person may be predisposed, can't say the word, to the risk of alcohol addiction. So if there's a family history, there's a chance really that you could be predisposed to being addicted, becoming addicted yourself. There could be a risk factor, and that's again it is in my family. So I personally, my family history backs that up, and that was somebody called Jureva et al. 2015. That's what I referenced that from anyway. That's where I got that information from. But I can back it up personally. There's environmental factors such as availability, culture, peer pressure, along with psychological factors. That's Marshall et al. Environmental factors that could well be. I mean, areas with poverty, or well, not just that. I mean, rich areas. It could be. Certainly availability, quite often you can find in more kind of what's the word I'm trying to use really, more deprived areas. You can quite often find off licenses and things doing major offers, on alcohol, and obviously people quite often, and not everybody, not going to, in those kind of areas can easily fall into addiction, whether it be alcohol or any other kind of drug. So again, like I say, it could come under environmental factors. It could be, like I say, where you live, pressure, work is environment, the environment you work in. Certainly it's quite known that Doctors, nurses, surgeons can be. And I know when I was in detox, we had, I think, we had a fireman, and there was a banker in it, and I'm sure it was somebody quite high up in the medical world. So those kind of things, can contribute to the causation or of developing alcoholism. Culture, well, you know, football. I mean, I was a football lad in the 80s. Kind of went hand in hand, really. I think it still does. Well, it definitely still does. I think I think the Western culture anyway, kind of we do drink. It's it's part of our it's it's a social, it's part of our socializing really, and then there's nothing wrong in it if you can do it properly. Absolutely every credit. I wished I could and I can't. Peer pressure, yeah, definitely. That can start really young, can't it, with peer pressure, but also in adulthood. You egg each other on quite. You can get amongst yourselves, and you're egging each other on, trying to drink more and more and more, and you're in competition, and before you know it, it can sneak up on you. I think I was probably trying to say, when I did this presentation. There's psychological factors too, so things like, if you've got depression, anxiety, other disorders, bipolar, borderline. Certainly borderline personalities as well, I think, can be quite prevalent with alcohol addiction or substance misuse addiction. Here, risk factors again, occupation, like I mentioned before, doctors, firemen, police, maybe anyone really, and high pressure jobs can quite often I'll have a few beers after work, or I'll open a bottle of wine when I get in, and before you know it, you're doing it every day, and then before you know yourself, you may be addicted. So hobbies on there is another one. So yeah, occupation, hobbies, access to alcohol. Maybe if you work in the pub trade or something like that, or maybe off licenses or something like that. I don't know. And exposure again, that could be working in pubs. And other venues where alcohol's served. And that information came from somebody called Winter 2016. When I did this presentation, I think I had about 20 minutes to do it, and I'm over that time now, so I'd have got stopped now if I was at uni, but I'm not, so that's it. Impacts on mental health. Well, this is interesting. The link between alcohol and mental health is now debated widely in modern society. That's by Bells 2014. Certainly, definitely, alcohol. At the end of the day, alcohol is a depressant. I mean, once your first few units, you get maybe a feeling of confidence and slight euphoria, and maybe anxiety lowers. I think it does. But if you continue, and this presentation was about alcohol addiction, so once you become an addict, and once alcohol addiction's got a grip, or any other substance misuse for that matter, or any other addiction, and that could be gambling or anything, mental health usually suffers, because it can impact. You can lose everything really. You can lose everything, financially, socially. You can be withdrawn, and so therefore mental health, depression, anxiety, self-harm, all can start snowballing once you become addicted, and like I say, that could be any addiction as well. So mental health is seriously compromised, and it's quite common or prevalent really to find alcohol misusers or dependent users or alcoholics to be also you know diagnosed with a mental health condition as well, so therefore it becomes dual diagnosis. Social impacts, like I mentioned before, is socially withdrawn. Family definitely can be a huge impact on families. Families. So I just where was I? Yeah, violence. A pop-up came on my computer. It distracted me. Violence definitely with alcohol, and again other substance misuse. Work. Interesting, like I mentioned before. Social input, like you work late. I'll ring in. You might feel rough one morning. So you think, oh, bollocks to it, I'm not going in. So you'll ring in and then maybe drink that day as well. So basically, things start to, it creeps in. You work. You could, eventually you could end up losing your job. I knew there was a guy when I was in detox. Like I say, he was a banker, and he ended up losing that job, and he was the boss. You know what I mean? He ran a branch and everything. And I think he was area manager and also, and he lost that job because of drinking, and his family also. He lost his family. So the impact can be serious, and like I say, and this happened with me as well, and many other people I know it's now come off alcohol, but you do become socially withdrawn, and I think that's the one of the ideas of AA really. So once you become sober, you don't become withdrawn. I use the gym. I used to use go to a gym, but anyway, so psychological impact on mental health. Albeit somebody may perceive themselves, so somebody may not like themselves. They may not think they're good enough. They may think they're not doing well enough at work, or they should be doing better. Can't cope without a drink, which is again, well, that's come under. I've got that under psychological, but obviously that becomes physical as well. The information comes from something called Wanograd et al. 2012. Emotional impacts on mental health is common mental health issues due to alcohol addiction, depression, and anxiety. They're apparently the two main ones, but like I say, things like borderline personality disorder, I don't know, maybe bipolar, I don't know, I'm not a healthcare professional myself, but depression and anxiety, they probably the more common traits or problems or difficulties or disorders within alcohol dependency, and I would imagine other substances too. I have to keep moving forward I need some better lighting really. I've actually got some lighting now, but I was just too lazy to put it up. And that came from Pearson and Martin 2012. So like I say, depression, anxiety, probably the more common emotional impacts on mental health due to alcohol addiction, and I'd say other substance misuse also in general. Spiritual and socio-economic status, how individuals see themselves in society. So they may regard themselves, how could I put it, how they see themselves in society. So they may think to themselves they are not doing well. So, for example, I knew somebody once actually. He was a bin man, and he said it's nothing. And I told him, well, it is. You have a role to play and a part to play in society. But some people, I was trying to use that as an example. Some people struggle with that concept. Some people don't see themselves as a valued, probably a word to use, a valued member of society. So again, that can impact mental health and then again lead to dependency or addiction. and that came from, and this is a weird reference, KSS and JR 2016. So that was impact on mental health. The medical model. The medical model is based on presentation of clinical features, DSM-5. However, Califano 2008 suggested alcohol addiction is a disease. Now that is a big debate really, because I don't do AA myself, but I think they say it's a disease. And like I say, the DSM-5, the diagnostic tool, this psychiatry, they say it's, well, they base it on clinical features. So again, you have to meet a certain criteria, or you're drinking more than once a week, twice a week, every day, blah blah. However, like I say, Califano suggests alcohol is a disease. So it's a tricky one. I don't know. Is it a disease? What kind of disease? I mean, I don't know. I mean, the medical model with the presentation. So somebody presents with clinical features. I can buy that. And the other thing with it being a medical model, does it? I mean, it's a really tricky one. I just think, for me personally, is it a disease? Is it a medical condition? Is it both? It could be both for me. But it's always quite widely debated, that is it a disease or is it something clinical or something? Something could be a disease. I don't know. But there's two contrasting views there from, well, the DSM-5 and Califano 2008. Genetics. Study into hereditary factors are quite high. However, a specific gene linked to alcohol addiction is limited. And that's somebody called, I can't even say it, it's Naya Ratzaka or something, et al. 2013. So hereditary factors are quite high. However, a specific gene linked to alcohol addiction the research at the time I did this presentation, what I found was quite low. So hereditary, well, I think I spoke about that in a slide earlier. There is a possibility of it being hereditary. Well, there's a high chance if the other family members have had issues with alcohol in the past, that you could be predisposed to. But we haven't actually found a gene, I don't think, as yet, unless there is now. So maybe you could leave a comment and maybe tell me, The medical model treats the physical symptoms of alcohol addiction. Yeah, well, that's the things like a camprosate for cravings and Librium to help withdraw. The Librium is a kind of benzodiazepine, so it affects your central nervous system as alcohol does. So basically, with the Librium, it's to aid your withdrawal symptoms really, or to make it as safe as possible anyway, because that's what can lead to a fit if you don't. So yeah, the medical model, that comes under the medical model. So you're given medication basically. You're also given medication to help with the cravings once sober, which is called camprosate. The medical model again. The medication is used to treat the physical symptoms of alcohol addiction. That's what I just mentioned before, isn't it? The National Institute of Health and Care Excellence, NICE, recommend the following. It's camprosate for cravings, and there's one called disulfiram. I don't know what it is, but I found it obviously when I did this presentation, to deter relapse by causing physical reactions to alcohol if it's consumed. Yes, I think it's called something else as well. It's basically, if once you become sober and you've detoxed and you take this drug and you drink, you will throw up. pretty much instantly, and it's that sensitive. Even if you put aftershave on, there's alcohol in the aftershave or a deodorant, you'll still be sick. You'll get a reaction anyway. It's called disulfiram, but I think there's another name for that drug. The thing is with that, the that's okay if the individual takes it. If they, the issue with that drug really, a physical reaction if alcohol's consumed. All the user needs to do then is not take it, and then if they're going to relapse, they'll do it that way. But if they have took it and they do relapse or something, or have a setback or whatever we call it nowadays, you're likely to be sick. Psychological model. The focus on the psychological model emphasises on behavioural characteristics. The psychoanalytic model approach may investigate childhood history and family history, which that also happens in therapy really, with like CAT, cognitive analytic therapy. They look at childhood history and family history. Behavioural characteristics with the medical, the behavioural, the psychological models. So that could be, I assume, negative behaviours or something like that, and environmental and social factors. Again, that's probably can be any, peer pressure or social factors. Again, peer pressure maybe or something like that, or the things which society you may be, whatever you may be in, kind of things. Environmental, Anyway, that's from Armour et al.'s 1978. So it's quite psychoanalytical approach though. May investigate childhood. Psychoanalysis does that anyway. This goes back, traces back. In any kind of psychoanalytical therapy. Prognosis, right? So prognosis for alcohol addiction, continued use. Prolonged alcohol use may lead to dependency, and addiction carries risk of developing alcohol liver disease, cirrhosis, resulting in death. That's Forrest 2016. Well, that's the ultimate price you pay from continued alcohol use. So alcohol dependency or addiction. You run the risk of dying really. Cirrhosis. I mean, there's no coming back really. I don't think there is from cirrhosis, at least at the latter stages anyway. I think it's pretty much game over then. So alcohol liver disease, but this addiction, risk of alcohol liver disease, but also the other, it carries the risk of mental health issues and ulcers, esophagus reflux, things like that, so this is prognosis again. Alcohol related deaths in the UK 2014, where there's 8,697. This is 1% of all deaths on the Office for National Statistics 2014. So alcohol-related deaths in the UK in 2014 were 8,697. This is 1% of all deaths. So so all deaths that occur in 2014, 1% was related to alcohol, which is it's fairly high. It's too high, I guess. Alcohol-related deaths for both sexes was higher in the north of England than the south. That's interesting. Higher in the north of England than the south. Now, I wonder if that's anything to do with funding. Because it's quite common knowledge, really, isn't it, that the government thinks England's London. That's for me anyway. That's my opinion. I would just wonder if that's the, higher in the north than it is of the south. Is that to do with funding? Um, is the drink up north stronger, than down south? Is it? I would lay. I mean, is there more poverty up north than there is down south? I don't know, but it does suggest it's higher up north than south, which is interesting, really. Maintaining sobriety improves health. That's Shaw et al., which it does. That's kind of it does improve health. Obviously, your liver's a really good organ. It does regenerate itself. How often, I don't know. It'll certainly do it once if you get there in time. Like I say, once if you get cirrhosis, I'm not sure about early stage cirrhosis. I think I don't know if they can do anything about it. But I know the latter stages, you'll die. So obviously, staying sober is is kind of imperative, really. It, certainly for your liver, anyway. I mean, it's not a guarantee, I don't think, but it certainly would improve your chances of remaining as healthy as possible. What else was there? So I got the conclusion there. The conclusion was alcohol addiction affects large parts of the population. Left untreated can result in death. Once diagnosed, staying engaged with care services, which I think is important, along with continued use of medication, there is a greater chance of successful treatment. Staying engaged with care services or addiction services. Again, I mean, when I came off alcohol, I was lucky. I was able to stay in service, certainly in treatment, for a good 12 months, 14 months maybe. Then I did a further 12 months as peer support. So I got, over 2 years within my local services. Now, again, with cutbacks, is that going to be compromised? I dare say it is. But as the president, as this it suggests, is staying engaged with services, is very beneficial, or certainly fairly, imperative you do so. The chances are, you are going to have a prolonged sobriety, and again, if you combine that with medication, I guess it suggests there's a great chance of successful treatment. But again, if services have been cut, that's going to make it more difficult for people. Psychological and medical models offer both clinicians and service user patients. Psychological and medical models both offer clinicians and service user or patients guidance and support. A support network is key for maintaining abstinence. Well, I think some kind of support network is, even if it's talking to a family member or something, I think if you can fall back on something like, or you've got a go-to, if you will, like say AA. If AA's there, you can go to AA 7 days a week. Well, in most places, I mean, probably maybe not in rural areas, maybe not, but I don't know. But it is available 7 days a week, and I think there is a drink line you can ring also. But I think, a support network is key for abstinence, maintaining abstinence. I think it certainly goes, my opinion anyway, it certainly goes a long way to establishing your abstinence anyway. That's alcohol addiction. I don't know if I've made it clear enough or what, or how it's come across, but anyway, I doubt you'll have got up to 44 minutes, but if you have, I hope it's been of use. It's more done for awareness, really, and something for me to talk about. But anyway, that's that. I hope you've kind of understood some of it. Please subscribe, leave comments, whether it's positive, negative, or whatever. I respect anybody's comment and I will reply. Subscribe, suggest anything, ask me anything you want. Make suggestions of what I could maybe go and research and talk about, or but yeah, subscribe. Hit the subscribe button, and there we go. It's a long video, really. A bit of a long. I hope you've survived till the end, and that's me for now. So, cheers very much for listening. If you have got this far, or even if you've listened for a minute, thanks very much. But even so, subscribe if you will. I'll see if I can build up some subscribers. And thank you to anyone that has, and again, thank you to anybody that watches. Anyway, look after yourselves, and I'll chat soon. Bye for now.